In mid-2017, 3 staff from the Mid-North Coast Local Health District spent a month working at world-class research facilities in Sydney.
The welcome was unbelievable. The red carpet was rolled out.
It was part of the district's commitment to ensuring staff have opportunities to engage in research on a broader level.
I didn't have any set plans about what I was going to research, and within a week we had some really good ideas.
Being at the Black Dog Institute was the best thing I've ever done.
Placements like this, I think, are probably essential or pivotal, because in a metropolitan setting, many of the clinicians and health care staff generally are sitting cheek by jowl with major research institutes and universities or whatever, so those that are inclined can easily start to get involved in that. More difficult from a rural location.
I work with a lot of people with Parkinson's disease here on the Coffs Coast, and one of the first questions they have is how can they be involved in research? And, you know, it's really difficult. You know, you have to go to the big cities to be involved, and this has really bridged that gap.
Every time I've sort of become involved in research here, it's been 1 or 2 other people who are interested, and it's been such a big undertaking to sort of pursue that on your own, whereas with the larger team down there, the almost unlimited resources of Garvan, there's no limit to what we can pursue from a research point of view.
Being at the heart of it, where the research happens, is the cornerstone of this innovative program.
Being in contact with people who do research all the time is going to be a great help. And we certainly noticed that with Vince. We were very confident that towards the end of his time with us, which was, let's say, only a month, we could see that we had particular things in common.
Since coming back to Coffs, you know, I've developed a number of relationships at the centre, and those relationships are now moving forward, and some of them are actually flourishing. And, you know, they're amending the ethics application at the centre to include people with Parkinson's disease.
The placements not only provided an opportunity for regional health workers to learn, but also to share, giving their hosts a different perspective.
So having the opportunity to have somebody from the local health district to come in and be involved in the development process for new projects, to inform the way things are designed, to provide feedback and interpretation to results was absolutely brilliant from our point of view. They were really interested in my learning from them, but they also were interested in learning from me, and so straight away they engaged me in utilising my skills in their project work, which is fantastic. She was brilliant. She was a real strategic thinker, so she was able to see something and recognise, even though if it wasn't in her area of sexual health, I can see where the benefit might be elsewhere in the health district. So I'm sure that there are going to be subsequent collaborations that are going to emerge out of this.
It's about creating research connections between the community and the cutting edge, bringing frontline experience to those who can help shape the future.
We are a community whose objective is to improve the quality of life and health for our population. And there are people who are at the service end and there are people at the create better future end, but we want to connect those two and create a synthesis.
From an academic point of view, they had a huge number of ideas, but then from the real world point of view, I had quite a few of my own where they maybe hadn't thought about them because it's something that they're not involved in every day.
Connecting research is about encouraging others.
Research doesn't have to be dull and boring, that it can make a difference in people's lives.
Grab the opportunity. It gives you time to step back, put yourself into another zone of reflection, looking at how researchers do the research, understanding the steps of research, and developing partnerships moving forward.
You should definitely apply if you can, because the opportunity is too good to pass up.